my name is Mona Firstenow. I'm a parent of two very diverse learners, young adults, and have a degree in speech pathology with a minor in neuropsych and counseling. And I worked in that field for quite a while. But my son, the younger of my two children, has multiple developmental disabilities. And as a young adult now, I'm beginning to look to the future. Probably should have started a long time ago. What's going to happen when I'm gone? And so we began some planning, and I started to do some research and digging into information. And good news is there's a lot of resources available. They're just sometimes difficult to find. And so that's the purpose of this webinar today, is to share some resources with you, not only from Bethesda, but also just nationally around this topic. So I work for Bethesda, and I've been with them for 9 years now in the religious life department. Began as a ministry consultant, and now I'm director of ministry partnerships, which means doing things like this, partnering with other Lutheran and Christian organizations to share Bethesda's mission and ministry and resources, and to find ways that we can partner together and enhance both ministries, or all the ministries we're in conversation with. So that's what brings me to this. So I have a personal interest, but also professionally, we often hear from parents who've had their adult child with disabilities living with them their whole life, and now they're aging and they're concerned about what should we do? How do we plan what will happen when we're no longer able to continue in this arrangement? And so let's begin. There's a little bit about Bethesda. We've been around since 1904 in Watertown, Wisconsin, and the headquarters are still there. We're now in 13 different states and serve residential and employment supports and faith supports for about 1,800 people, have 3,000 staff across the country. And if you're interested in which states we're in, I can say that the West Coast: Washington, Oregon, California, Colorado, Texas, Kansas, Missouri, Illinois, Indiana, Wisconsin, Minnesota, New Jersey, and I think I missed one somewhere in there. But there's a map on our website. You can see where we're located. We base all of our work on Psalm 139. And as parents, this resonates with us. And so let me just share that and read that with you. We celebrate God's handiwork of our children with intellectual and developmental disabilities. So Psalm 139, starting at verse 13. For you formed my inward parts. You knitted me together in my mother's womb. I praise you, for I'm fearfully and wonderfully made. Wonderful are your works. My soul knows that. My frame was not hidden from you when I was being made, when I was intricately woven in the depths of the earth. Your eyes saw my unformed substance. In your book were written, every one of them, the days that were formed for me, when as yet there was none of them. And so we know that God has created everyone uniquely and specially and specifically. And so we celebrate God's handiwork, and while recognizing that it's an interesting and different journey probably than what we had planned through life. Here's some data for you. Nearly 1 million households where the adult with disabilities is living with caregivers 60 years or older. Nearly half of the caregivers are over 50. 10% are 75 years or older. And 52%, so over half, spend at least 40 hours a week in support for their loved one, which is nearly double than that of children caring for aging parents or spouses caring for each other. Significant number of us. You are not alone. But here's the reality, our caregiver reality. We love our children, and we're tired. There are daily and constant demands, and there's a need for support to plan for the future. We're not quite sure how that looks, and it looks different for everyone. So looking at the options and finding resources are crucial. This is a true statement. Family can be tricky. Extended family can be tricky when making decisions and determining future plans, and navigating that can be it can be challenging. What about a different housing option if your loved one is still living at home with you? And I sort of tongue-in-cheek put options. What options? every state is different, and every state receives different funding sources from the federal government, and many resources and options for housing that are available in one state are not available in another. So I can't give you a general statement about housing options. However, I will give you some resources to look for other options that might be available as you're planning for the future when your loved one is no longer living at home with you, if that's your current normal. And then there's quality of life questions. How do we ensure that the quality of life our loved one currently enjoys is maintained or even improved when a situation changes? So we'll walk through some of these things a little more in depth and unpack them a little bit. And at any time, if anyone has questions, would you just write them in that chat bar to Carol, and she'll share them with me. I'm not sure I can see them this way. So if you have questions, stop me at any time. I have no problem with that. So here's another scripture that I find comforting and often share, but for me it's personally comforting. Psalm 147, verse 3. There are times when we feel really broken and burdened, or just tired, and this is a good reminder. God heals the brokenhearted, and he binds up their wounds. And I love this picture of the Band-Aid with Jesus. We know that our comfort and rest lies in him and giving our cares to him. So let's talk a little bit about some surveys and some data. I'm going to see if I can move this icon out of the way so that I can actually see my own screen. There we go. Family and individual needs for disability support. So there was a survey done. It's called FINDS. That's the acronym. And really, this is just to share with you that you are not alone. There's a lot of us are in this situation, and it's only going to increase as boomers age and as the silver tsunami comes. These percentages are only going to increase. So know that you are you are not alone. You are in good company, and the good news about that is that there's a lot of resources being developed because these numbers are so huge. So these are the main concerns of families who are caring for their loved one with intellectual or developmental disability. Their main concern, the top one, that the quality of support for the person will go down. So if I'm no longer caring for my son, the biggest concern is that his quality of care and quality of life will decrease, because no one will ever love him and care for him as much as I do, right? Does that resonate with the rest of you? So that's the number one concern. The number two, close behind it, 78%, the person with intellectual and developmental disabilities won't have friends or will be socially isolated, that their natural connections they have now will not be maintained. That no one else will provide the support for that family member. That there isn't anyone in extended family or that there will, or currently involved in their life that will be able to continue to support them, even if it's just emotional and social support. That the person, your son or daughter or loved one, will have to live somewhere they don't want to live, like a nursing home or an institution. That there might not be other options and that they'll end up someplace that they don't want to live. Where there's concerns that the family member will see their health deteriorate, which reflects directly back on quality of support and who's going to look after them, and they're going to be living someplace that they don't want to live, that their health might deteriorate. That's 74%. So families have huge concerns about this. That the person will be abused or neglected. Comes right behind health deteriorating. We're very concerned about our vulnerable loved ones and what will we do to protect them, and how will they be able to, who will advocate for them if they're not able to advocate for themselves. And then the last one of the top 10, I guess, 7 or 8, this person, your loved one, will be financially exploited, that someone will somehow use their funds for things other than for their own quality of life. So if you have any of those concerns, you're in good company. It's not great concerns to have, but there are a lot of people who have those concerns. And as I said, there's good news. Because those numbers are so high, there's a lot of new resources and supports coming out, and we'll talk a little bit more about those. I recently connected with a group with the ARC at Washington State, which is where I live, in Vancouver, Washington. And they have a group in Seattle that are creating resources to help plan for the future. And I'll send the link out afterwards to their forms. They're all free, downloadable, printable, available, to create some plans for future and in the event of emergency. So they have forms and thought process and questions for you to answer and think through about how to plan for an emergency care. Say, God forbid, you're in a car accident tomorrow and no longer are in the hospitalized for a length of time. What's your emergency care plan for your loved one? Or in a crisis, again, death of someone, unexpected illness, that crisis situation, how to plan for that. So they have resources to help you plan. Future planning for how to make transitions from the current situation to whatever the next situation will look like. How do we protect the financial resources that are currently supporting that person, whether that's private or federal government, state government resources? How do we protect that, ensuring that those don't get lost or denied because of a crisis situation? How do we find caregivers, and making a plan for finding caregivers to support developing caregivers who begin to know and care for and become part of the extended family natural support for this person. And then also some resources about how to approach your family members. If you remember, I said back here, family can be tricky. And sometimes those discussions are difficult to initiate or can become emotional. And so there are some resources available for how to plan a family conversation and how to approach the outcomes and the objectives desired. And it will be emotional, but to help navigate that. So there are lots of resources around those caregiver concerns for planning for the future. And so I always like to quote this one, Jeremiah 29:11, because we need a plan too. He has a plan. For I know the plans I have for you, declares the Lord. Plans to prosper you and not to harm you. Plans to give you a hope and a future. And so he has plans for us, and we need to make a plan as well so that we can have less concern and worry and know what's going to happen. One of the things that I mentioned is in an emergency or a crisis, and it's good to make a plan now for steps to be followed in an emergency. So if you were to be in a car accident this afternoon, do the important people know what to do with your loved one? Yeah, if not, then it's really important to make that plan, because we never know when emergencies will happen. So there's a notebook. Make a notebook with all the important contacts, extended family, siblings, other important people, doctors, therapists, medical personnel, et cetera. A notebook with all that information, but also who should be contacted first, and what the process and procedure will be for your child or your loved one. And then be sure you tell each of those important people where that notebook is, or at least the top 2 or 3. Where is that notebook that has that plan and those all those contacts in it? Do they know what it is, and can they find it? Is it obvious? Because if it's an emergency situation, there'll be a lot of emotions and people won't be thinking real clearly. Where was that notebook? Where is that information? And then discuss as much as possible with your child or loved one in case of an emergency. Not to get graphic and worry them, but we can couch it in such a way that if there was if I wasn't able to come home one day, this is what would happen. Who would be the first person that would call, or who would be the people that would be there for them, so that they're not surprised, so that they're informed. And if they are able to understand and follow the notebook, then have them participate in creating that notebook and deciding and understanding who is it that's going to come and help me if there's an emergency situation. Any questions about any of that? I can't hear anyone else, but. Okay, again, the Arc of Washington, and I'll send you that link, has all kinds of forms and questionnaires that you can download and print and use to help guide your creation of your emergency care notebook. And again, just continuing that planning for a crisis situation. So there's the emergency situation, then there might be a crisis. What if there's a, I don't know where you live, a hurricane or tornado or earthquake or some sort of other crisis. Your spouse has a crisis and you need to go be at the hospital with them. So it's better to be proactive to make that plan. Again, identify the key people that will step in, and then include this information, how to calm your loved one or your child during that chaos of the crisis or the emergency situation we just talked about. What's going to be most calming and effective for them in a crisis, in chaos, in confusion? Note their personal preferences. Often things that are familiar or comforting in that situation of chaos. So if they have a favorite food or drink, if they have favorite music they listen to, if they have a favorite item that they like to have with them that gives them security and comfort, be sure that those are written down and noted in times of crisis or emergency. My son or daughter uses this item to feel safer and secure, or this person. And then also, as you're thinking through, when does this become, or when does it shift or transition to a long-term plan? So if you're in the middle of crisis, you have an immediate crisis or emergency plan. Some of those crisis or emergency turn into a long-term situation that that changes the landscape. And at what point in time and how does it transition from a crisis plan or an emergency plan into a long-term plan? So I have a brief example. I have a friend here in my community who is a single mom and caring for her young adult daughter with intellectual and developmental disabilities, and she had a stroke. No warning and no, it was a huge surprise. And she was a primary caregiver, and her other children, the siblings of her daughter with disabilities, live in other states. And I watched this play out, thinking through this planning that I was doing for this conversation and this creating this resource. As siblings came into town and as they navigated the hospital and then the shift to long-term rehab and what's going to happen and how are we going to plan this, and they didn't have a plan in place, and it was very chaotic, and now it looks very, very different for my friend and for her daughter in terms of what their long-term plan will be based on what's happened. So the note on that, the key point is make a plan, because it is chaotic and emotional when a crisis happens anyway, and it's good to have a notebook to walk you through it. So those were emergency and crisis kinds of planning. This one is for future. So we probably are planning for our retirement. Maybe you're in retirement, already have done some future planning, and here's some things to consider. And again, there are resources to help guide your development of the answers to these for your family. And these are the things to consider, that you want the same level of lifestyle that your loved one is accustomed to. If they have a job, if they have social groups, the friends, activities they do regularly, people they see regularly, that you want that to continue as long as they want it to continue. And so our goal is to make sure that there's that same level of support for the lifestyle they're used to. The relationships continue, friends, family, co-workers, that those relationships continue. Delineating family traditions. For Easter, we always do this. For Groundhog Day, we always do a silly thing and watch the movie. Those kinds of things that are family traditions for your family that your loved one will want to continue because it's been their tradition all along. And those are internal to the family. Family members will know, but it's good to write them down so that others who might come in as support staff or in another living situation will know, oh, this is coming up and this is what they typically do, so they can continue those family traditions. Identify not only where you attend church, but how your loved one participates. Do they go to a Bible study? Do they go into worship? Do they help in the nursery or with Vacation Bible School? How do they participate in their church, not just which church and which service? And who are the key people? Again, those relationships. Key people at church that are relationships that need to be continued and nourished. Same with work. How do they get to work? How important is work? How long have they worked there? What do they do? Those details so that people can talk in an informed way about work and ensure that those same sorts of connections and things continue. And then leisure, I think, is one of the things that really gets missed. Even when people are good at making plans for future, oftentimes they don't really think through this leisure time. So, for example, my son loves to go fishing, and he would go fishing all year round. And he likes to go fishing. He doesn't care if it's raining or even snowing. He likes to go fishing. So if I didn't really describe that well, his desire for fishing, he might communicate it, but with someone who was there, but they might realize just how much a part of his life it is and how important it is for him to be able to go out, be outside and participate in that activity. It's something he loves doing, and we don't want that to go away just because I didn't share how important that was or what those activities were for him. Transportation is huge. It's a huge issue, and man, if you've got some ideas about how to solve that, I'd love to hear them. It's an issue across the country for this population of people with disabilities, but it's also an issue across the country for seniors. You may be finding that yourself when you no longer are able to drive, and getting where you want to go for all of these things up above on this list becomes a huge challenge. To continue those relationships in church and leisure, the transportation is key, and it's huge and it's expensive. So if you've got some brainstorms about how to address that, I'd love to hear it, because it is a huge issue. And then future planning for medical professionals. We probably all have notebooks that say this is their primary care doctor and their specialist and so forth. But future planning in terms of, is there a point in time when you would like for your loved one to shift to from their current primary care to someone who specializes in degenerative neurological diseases or dementia or in senior elder care, so that those professionals can be engaged after you're gone. Any questions about all of that? Are you all overwhelmed now? I'm hoping to give you some resources, not just give you a list of things to do that you'll feel like is way too much. Okay, so we'll move on a little bit to financial resources, protecting them, but also just some resources about that. There are a federal program of ABLE accounts. I am not a financial expert, so I'm not going to go into details, but these are things you should explore. And again, there's all kinds of resources on the National ARC site, and I have that in one of the last slides as a resource for you, that describes all of these and points you to experts around these ideas. But an ABLE account is a way for you to put in money aside that won't impact any benefits that your loved one is getting from the government. So it's similar to a special needs trust, but doesn't require as much legal setup or documentation as a special needs trust might, which you see down at the bottom of the list. So there are ABLE accounts. It's through the federal government. Guardianship protects their financial resources, but if you're the guardian, then have you got some future plan for who's going to be the guardian after you and then after them? Should there be issues that make it no longer able for them to be the guardian or the representative payee or to manage the finances? Understand your Social Security benefits for them if they're not receiving them. We'll get to that in a minute. Be sure that your loved one is at least signed up and gone through the application process for Social Security benefits. I understand that landscape is ever changing, but it is a resource that could be used and can be used as long as you've gone through the process. There are some income limits when you have Social Security benefits, but they actually are very reasonable, and with ABLE accounts and special needs trust, you can put money aside from other sources. They're not burdensome. It's just important to know what they are and to have, you can have a benefits analyst help you walk through, here are the limits and here are the points at which you would need to be concerned about income jeopardizing other benefits or programs. So. And then special needs trust, and that's where you set up so that people who might gift this, your loved one, or a legacy gift or from inheritance gets protected if it's designated specifically to a special needs trust and won't impact those other resources and support services that are coming through other agencies. So it's important to look through that and decide which of these things are important for you. I think it's important to explore all of these, all 5 of these, just to be sure you're aware, and add that information into your notebook so that others will know too what you've set up, where they are, etc. So if you set up an ABLE account, how do you access it? What's the account number? What's the process? Same for special needs trust. If you set that up, then how do you access it? Where is it housed? Which bank or financial institution? All that information then should be included in your notebook of information. Any questions about any of that? Okay. Here's just some general information. So, and I'm sharing this just so if you've not done any of these things, you don't feel guilty about having not done it. So here's a real data figure for you. 75% of families are not connected to any of these services that I've talked about or any of those things. 75% of families who have an adult, that means over the age of 21, with intellectual and developmental disabilities. And everyone in this system, service system, delivery system says, all of the agencies and providers say, sign up. Even if it just puts you on a wait list, sign up. Go through that application process, even though it can be burdensome. So for, through the Developmental Disabilities Association administration, application for Social Security benefits or disability benefits, sign up and go through the process, even if it just puts you on a wait list. Because, if you drop down to the last one, sometimes a crisis situation is a catalyst for services. So if you're on the wait list already, and then there's a crisis, someone dies or has an accident, or there's a significant health need, that'll bump you right onto services, into services, and take you off the wait list if you're on it. If you're not on it, then it's a longer process to get through that application and have some services available to you. For example, if you've gone through that process and you're on the wait list, your loved one with disability is on a wait list, and you have a sudden health crisis, they will immediately be put into services and can be put in emergency crisis placement where they can be cared for until other arrangements can be made. So being on the wait list might seem like, well, what's the point? But if you are, then you're eligible for services more quickly in the event of a crisis, is what I'm trying to say. And then It's not all a bed of roses, though. I mean, if you are on the wait list and if you get signed up for services, even if you have services, 25% of families don't have enough resources, even if they are receiving services. So if they're receiving services from DSHS, the DD administration, from Social Security, Medicaid personal care, even if they're receiving all of those, still 25% of families don't have enough to cover the need for their loved ones. So there's never enough, or rarely enough. But it's important to go through that process and learn about the resources. And there are lots of people that can help you with those kinds of things, planners and benefits analysts and caseworkers, et cetera. So I'll point you towards them. So again, I said family's tricky, but it is a family affair. Some are family relatives and some are extended family that are like family. Let's have that discussion. So here are some basic questions, and again, there are some forms that can help guide this conversation available through the ARC. Who's going to care about them? Where will they live? Who's going to care for them? So care about them means care about their quality of life and monitor, see how things are going, stay involved. Who's going to care for them is doing that direct care if they need direct care for activities of daily living. How are you going to navigate within the family any change or transition that needs to happen? And how are you going to ensure that the quality of life is maintained or improved? Those are key questions for a family discussion. It'll bring up a lot of other things as well, but these are sort of the key beginning questions to ask and have a conversation. So I sort of tongue-in-cheek said earlier, housing, what options? It is difficult, and in each state and community is very, very different, but there is a national care registry that you can access by state that will help you identify who are licensed and trained care providers in your community. There's also a system of individual providers, some of whom are part of that care registry, some of whom are not. They have to go through individual training and background checks and security and those kinds of things. So there is a list. You can just Google some of these, care registry or individual providers. There is supported living, which brings in supports in the person's home. So that could actually come into your home where they're currently living and provide some supports there in their home or their own apartment. Shared living is now a newer model where people with and without disabilities are sharing housing and support of each other. I'll tell a little bit more about that. Host homes are like a family who decides to open their home to include a person with a developmental disability in their family. We have multiple, and Bethesda operates multiple states which have host homes. Texas, Colorado come to mind. And that's just a family opening up their home for your loved one to live with their family. And then there are provider agencies like Bethesda who can help facilitate all of those, supported living, shared living, host homes. The old model of group home living is still in existence in some places. And provider agencies then provide the staffing based on an annual assessment of the level of support need. And in a variety of housing situations, an own apartment, a shared house, with others with disabilities and care staff as needed. So there are a lot of options, but they look very different depending on the community and the state where you live. We have a new model that's just beginning in Minnesota, just outside of Minneapolis, in Victoria. It's a new model that we're exploring, and we broke ground in August and hope that it will be finished and occupied by next summer. And it's really creating shared living model, but independent housing, like independent apartments or units. So might be a senior citizen with next door to a person with intellectual and developmental disabilities. The baseline is that they need to be fairly independent, so work or daytime activities, et cetera, It's a shared housing model, not care provider model. So Christian independent community housing communities integrating adults over the age of 55 with young adults with developmental disabilities. And they can be neighbors and befriend each other and live in community. That's we hope to open. So you'll see here, there's a building that looks like apartments, and then there's the community and rec center and some other house units that have smaller number of people sharing. And we hope to open these in multiple cities across the country and multiple states across the country to create that sense of community, that shared living community, shared community between seniors who often are on fixed incomes and looking for housing, or just want to live in community, and young adults with developmental disabilities who want to move out on their own and be a little more independent, but still want to be part of a supportive community. So we're to the resources. Let's see what time. Oh, I'm good. I've mentioned the ARC several times. So the ARC Center for Future Planning is exactly what it says. It addresses all of those things I've talked about and has forms and questionnaires and so forth to help you walk through all of those areas of future planning. They're all free, downloadable, printable, and they have people you can contact if you have questions, and they can point you in towards good information. So I would suggest that's the first place to start. They have a new initiative, and I've been seeing some publicity about it in the last several months. And so they've really upgraded and expanded all of their information and supports because of that data that shows it's such a growing population of seniors who are still providing care for their adult children with disabilities. So I highly suggest you go there first. Another place that has really good process and resources is Future is Now. It's a curriculum that helps aging caregivers or older adults, family caregivers, to plan together. So this is a curriculum, a workbook you can walk through together to make those plans. If you use this in conjunction with the resources from the ARC, you'll have a really great product when you're done. So, and this came out of caregivers who were walking through this process, and you see that National Alliance for Caregiving gave this curriculum an award because it was so well done and researched, as well as easy to navigate for families. So that's another great resource to walk through these conversations. There's a Special Needs Alliance. That's a national organization. That's really around attorneys and law, legal disability law. So if you have issues that you need legal support, Special Needs Alliance is one. Also in each state, there's a disability rights organization. So in Washington State, where I live, it's called Disability Rights of Washington. There's one in each state, and they offer free and consultation low or no-cost consultations around legal issues for people with disabilities. And so they're also someone who can help you if you have an issue. Special Needs Alliance does a lot of benefits law and helps navigate some of those other things. Not necessarily if it's a legal action required, but navigating the benefits and laws around what can and can't do for people with disabilities. The Family Support and Research and Training Center, another organization, researchers and folks who pull together and generate knowledge and resources to address the needs of families. Sibling Support Project is a great resource as well. My daughter participated in sibling support when she was younger, and then took a few years off, and then asked to go back to it, and now has her finger on the pulse of what's happening in the sibling project for adult siblings, and it's good for them if they're interested in knowing they're not alone, and to walk through the discussion about being a sibling of someone with significant health and developmental or mental health care concerns, this can be a great way to connect with people and also have resources for them as siblings in the family. Here's the ABLE National Resource Center that I mentioned around the ABLE accounts. They're very complex to understand, but pretty easy actually to access and set up. So it's a really important tool for financial planning, and they can help you navigate that and have a lot of resources on their website for understanding what the scope of what an ABLE account is and is not, and how to set one up. And then in each state, oh, misspelling there, that should say state. Each state has a developmental disability council. So I just mentioned they have a disability rights organization in each state. They work together with the state developmental disability council, and that's a group comprised of parents and self-advocates and agency reps in each state. And they are appointed by the governor to advise the governor about policy and resources for families. I served on our Washington State DD Council for 7 years as a volunteer, and I learned so much for our own family, but also learned so much about the bigger picture for families with disabilities that it really spurred on my advocacy work to be sure and share as much information as we can, because there's so much to understand and so difficult sometimes to navigate. And I feel those of us who have resources and access to resources need to share it to make it easier for those who may not have heard about it yet. So the State Developmental Disability Council, they should have a website, and they have lots of free resources for families. I encourage you to explore that. And if you're interested, apply to be a representative on it and learn what's happening in your state and have impact into what's happening in your state. So I haven't said much about Bethesda, and I'll say a little bit more now. We are a Christian residential and employment support provider, and we've been doing it for a long time. And we rely on churches and organizations and individuals to support us, either through prayer or through developing relationships with the people we support, sharing resources, et cetera, and to enhance the lives of people we support. So we have recently started a new initiative to develop support teams. Churches, organizations, individuals can be part of that. It could be something as simple as sending a card to a person we support in a city near you or a city you always wanted to visit, or to the staff to encourage them in the work that they do, to engage in visiting or service project or sending a birthday box. There's all kinds of opportunities to support Bethesda's long history and hopefully long into the future effort to enhance the lives of people with disabilities. There's lots of resources for churches to help them be more inclusive and support families better. And we have ministry leaders and consultants across the country who can help with that effort. So this new initiative for support team really is looking at 3-year commitment just to be engaged in whatever that looks like for you, with people supported or staff, and using your gifts and talents to support Bethesda by talking about Bethesda, by sharing resources, by praying for us, etc. So if you want any more information about any of that, we'd love that. Know that we could be a potential residential provider for your loved one. We do provide services in 13 states. If that's something you're interested in exploring, you can go to our website. You see it listed there. And search locations, and you can click on your state and see what supports and services are available in your state. If you're interested in more information, there's a regional director listed for each of those states, or you can contact Susan Kaufman. She's our Vice President of Operations, and she can connect you to the right person. If you're interested in the Cornerstone Village, that new shared living concept, Tom Campbell is the person heading up that initiative in Minneapolis area, and he would be happy to answer your questions. And there's my email on the bottom. If you have any questions about this or anything else as a parent of a young adult with developmental disabilities, I'd love to hear from you and connect with you. If I can share any more resources, I'd be happy to do so. I will send out through Carol the several other documents and links. I don't think in this PowerPoint that the hyperlinks were enabled, so I'll do that so you can click right through to it and don't have to search, and I'll get that out to her yet today so you can have access to that, and hopefully that can be added to the website. So Carol, do we have any questions? I can't hear anyone. I can't even see you right now, so do we have any questions from anyone?
We don't have any questions. And if anyone has a question, if you can type it in that Q&A box there, it will show up so that Mona can read your question if you have any. So
Evelyn raised her hand.
and as we
I have a message that says Evelyn raised her hand.
Okay, all right.
Hi, Evelyn.
Okay, I am going to allow Evelyn to talk. Look at that. So if you can talk, if you can unmute.
It looks muted to me.
If you can unmute the sound on your computer, which you should be able to do on the lower left hand of your Zoom window.
Can you hear me now?
Yes, we can.
Yes. Hello.
Oh, yay. Okay, my question is, I have a son whose IQ is just like maybe 74. And he did go through regular high school with special classes here and there. So, and he has very mild cerebral palsy. I don't see anything listed today that really, and he is schizoaffective. So I don't really see too much available for someone like that. And I'm 67 years old, and I've done a lot of planning with Thrivent financially, but as far as living, I don't see too much for that.
So does he have any services through the state?
So
through the Developmental Disabilities Administration, or?
Well, in Florida, they have some stuff, but it's like the developmental disability that IQ level is 69 and below.
Yeah, except for that, why don't you, if you don't mind, email me, or we can have a conversation outside of this. But I think there are things available that we can help you navigate. We don't have services in Florida, but we have some partner congregation in in the Orlando area, and we have some other resources we can access. We used to have services in Florida years ago, and so we can probably point you in a first place to start that might help you find out if there are other resources that are available for you.
Okay, all right, because I know I'm not probably the only family like that has tweeny issues.
Right, yeah, needs support but don't quite qualify or don't seem to. Yeah, that's a huge issue.
Yeah.
But we can point you towards a couple of places to at least begin asking different questions.
What email address? To Susan or Mona?
Do to me, and I'll hand it off. I'll do an email intro, so it's just not some random out of the blue. And I can send you some other information internally to the email, and then I'll introduce you to someone to help you with those conversations.
Okay, so that's Mona.
Evelyn, it's Mona at the email address that's on your screen right now.
Oh, okay, great.
And yeah, also have that information on our website so that you can go back and get that. It will be available there.
Where are you in Florida?
I'm in Port St. Lucie, which is about 2 hours south of Orlando, but that's fine. You know, Orlando's good.
Yep. I'll be there later in February, but I also have a friend who lives in Vero Beach,
Oh, yeah, that's
So,
right up the road from us.
yeah, yeah. So we'll talk later.
Okay, great. All right, thank you.
Okay.
Yeah.
Yeah, you bet.
All right, and Walter Teachin, if I've pronounced your name correctly, I hope so, didn't have a question, but he says he simply appreciates the comprehensive help list. Our congregation
you're
is
welcome.
working with Tom Campbell at present to determine future possibilities. I
Oh, great.
personally will be passing this info on to a couple in our church who are raising many of the questions raised during the presentation. So he's saying thanks to you, Mona.
Oh, you're very welcome. I'm glad it was helpful. That was the whole point, for hoping it'll be helpful. Great.
All right, if there are no other questions, then we will have the PowerPoint slides from this presentation, as well as the recording of the presentation up on Aloha's website within the next day or two. And you will receive an email with a link to that information as soon as it is available. And very much thank you for being a part of this webinar today, for attending this webinar, and for your interest in it. Our next webinar is at the end of February and is on quality care in a nursing home kind of environment. So check that out if that's of interest. And I want to thank Mona Furstenau, our presenter, very much for this presentation and for being willing to kind of do our best to kind of work around whatever issues are working not in her favor.
A little technology challenge there, keep me on my toes.
Well, we all have our technology challenges. So thank you very much for joining us today. And you will be receiving an email with the links in the very near future. And thank you all for all of your support of Aloha.